took a bit of an ambitious task today that I'm going to cover the whole gamut of Mycoplasma bovis and maybe not go into detail on a lot of things, but try and cover it quite broadly. I'll give you a caveat at the beginning that I'm a veterinary pathologist, so I'm not a clinical veterinarian. So in terms of managing disease in specific herds, that's really not an area that I work in, and I think you need to contact your clinical vets to get advice on that. So I think my focus certainly is on the pathology of it and the types of diseases that occur and how the disease develops, but not so much on the details of the management of the disease. Okay, here's what we're going to cover a little bit, very brief of characteristics of the bacterium that cause this. Host and transmission, I think, is quite important. Range of diseases is really what I work on, so I'll talk a little bit about that. How the disease is diagnosed, what I would call pathogenesis, or how the disease develops, and then a very little bit at the end on general aspects of how the disease is controlled in groups of animals. And I'd also say a lot of the research I've done has been in the context of beef cattle. I think a lot of that's relevant to veal cattle as well, but many of the images that I'll show you come from beef cattle. Mycoplasma. Gosh, I tell the vet students, don't get those two confused, and I did it. Mycobacterium causes tuberculosis, which is not what we're talking about today. Mycoplasma are really simple organisms. Their genome has been really refined over evolutionary time, and they've lost a lot of the ability to survive on their own. And the implications that I think are important for us are they have a really simplified genome. A lot of bacteria can produce all of the nutrients they need, but mycoplasmas are really dependent on the calf in order to get nutrients to feed the bacterium to grow. So they're pretty simple bacteria. Because of that, that impacts the diagnosis because we can't culture those bacteria on the usual medium that we, like the diagnostic lab would use to culture bacteria. It has to be a specialized type of culture. The good news for you guys are there's really good diagnostic tests available, and the diagnostic lab in Guelph, which I don't directly work on in anymore, I think has always had a very good Mycoplasma lab. So we have a good ability here to do that. The other point of that reduced genome is that, again, a lot of bacteria make toxins that directly damage the host tissue, but Mycoplasma doesn't do that, and we think that it's always or only the calf's inflammatory response that is responsible for the disease that we see. It's not damage from the bacterium, but instead the bacterium, the calf's tissues know that the bacterium is there, mounts an inflammatory response, and that's that calf response that's important for the disease. I'm not deeply involved in antimicrobial resistance, but there have been a lot of studies looking at antimicrobial resistance, and I think one of the importances is that the intrinsic antimicrobial resistance of some of these Mycoplasma bovis isolates is a reason that some calves don't respond well to therapy. So these are just, there's been many studies of this, but this would be 3 of these studies, one from Ontario quite a few years ago. I mentioned that, in fact, I forgot to mention that Mycoplasmas don't have a cell wall, and that makes them intrinsically resistant to some of the antibiotics we use. Penicillins would be the classic one. So these antibiotics here are not effective against any mycoplasmas simply because the bacterium doesn't have a cell wall anymore. But in addition to that, there are quite a few other antibiotics for which there is considerable resistance present. And I've just highlighted in green a few that might commonly be used to treat bovine respiratory disease. The other point to make from this is that it certainly varies over time, and it also varies by region. So this would be Ontario data, this is Western Canada data, and you can see in this data set, many of these macrolide classes of antibiotics, many of the Mycoplasma strains are entirely resistant to those antibiotics. So one reason that calves don't respond well to treatment for Mycoplasma bovis can be because the bacterium are resistant to some of the antibiotics that we use. I'm not going to go into more detail on antimicrobial resistance. Mycoplasma bovis in Ontario, I would say, is pretty much entirely a disease of cattle. Bison certainly are highly susceptible. I don't think you're raising Veal bison probably, and I don't know very much about bison, but in Western Canada, Mycoplasma bovis is a big deal in bison production. I know nothing at all about water buffalo. These species here are susceptible to infection with Mycoplasma bovis, maybe develop disease, but it's really not a very important cause of disease. And I think for us, one of the I think relevant points is that there's been no reports that infection in these species can transmit the disease to cattle. So it's really a cattle disease that we're dealing with. Transmission, I think, is something that's pretty important to people like you. This is a highly contagious pathogen. When we look at it in beef feedlots, by about 2 weeks after calves come into the feedlot, the vast majority of the calves, well, I should say when they come into the feedlots, there's often very few calves in the group that are infected, or at least we can detect infection. But within 2 weeks after arrival, by far the majority of those calves are infected. So it seems to spread very quickly among individual animals, especially if they're being brought in from different sources and combined together. The important routes of spread would be direct contact, and this is probably nose-to-nose contact, and it probably represents transfer of nasal or oral secretion between individual animals. That would be one important method of transmission. And the classic example here in dairy herds, for example, would be bringing in new animals. But of course, if you're bringing in calves from multiple different sources, it's highly likely that some of them are infected with Mycoplasma bovis, and it can certainly spread within a group of calves. The other well-recognized method of transmission would be contaminated milk or colostrum. So Mycoplasma bovis also causes mastitis, and those cows that have mastitis, or even cows in that group that don't have clinical evidence of mastitis, they can shed Mycoplasma bovis in the milk, and that can transmit it to calves as well. So feeding practices are important, and I'll talk very briefly about that later. Aerosol transmission would be important to think about. So even if calves don't have nose-to-nose contact, can they spread it through a room like we're in now? Even if you and I don't have nose-to-nose contact, maybe I'm, the droplets that are coming out of my airways could transmit it. And I don't think we have good data on whether that occurs. I was involved in the back in about 2018, 2017, there was an incursion of Mycoplasma bovis into New Zealand, which was previously free of the disease. And there was a lot of studies done at that time, and there was no evidence that animals in adjacent farms had any transmission from an infected farm, which would suggest that aerosol transmission is not important, whereas nose-to-nose contact probably is important. But I think the jury is still out on whether there is the possibility of aerosol transmission within a room of calves, for example. Semen, artificial insemination, and embryo transfer, I think until recently were really not recognized, but I think there's been solid evidence recently that those can be methods of transmission. And again, that incursion into New Zealand was thought to be the result of imported semen. But again, I think it wasn't proven, but that seemed to be the most plausible method for it to enter the country. Transplacental spread can occur, so pregnant cows can transmit Mycoplasma bovis through the placenta to the fetus, and then those fetuses can be born infected and develop disease very soon after birth. I think that's a minor method of transmission compared to this nose-to-nose contact or milk and colostral transmission, but it certainly is recognized. And then environmental contamination is another possibility. And again, I think that's relevant to you people. Mycoplasma bovis is quite fragile, but it can survive for a period of time in the environment. We don't really know if that's an important method of transmission, but for example, disinfection of feeding equipment seems like a good idea. We don't really know. We don't have solid data to what extent that is an important method of transmission. Okay, range of diseases. This would be the classic disease. This is what I call caseo-necrotic bronchopneumonia, and I'll explain that in a moment. This is a beef calf, of course, in a feedlot. This would be the trachea and the head up at this direction. We've opened up the right side of the chest. If you draw sort of a line down here, this is all very firm lung, and this is more normal lung, at least this lung here. And the really characteristic finding would be these multiple nodules within the lung tissue. They're little circular nodules that are raised up above the surface of the lung, and then they join together to form these large nodules. Caseous is just a Greek word to mean cheese, and when you cut into those, I don't want to say it after lunch, but it looks a bit like feta cheese or sort of a moist cheese, so that's where the name caseo-necrotic bronchopneumonia comes from. I'm glad we don't have a cheese platter at the back to make that more real. These are always chronic diseases, so other bacteria that cause BRD can certainly cause acute diseases. Mycoplasma bovis, we think, is always a disease that smolders away for a period of time. It may appear to you as an acute or a very abrupt onset, but always that disease has been developing over at least 2 weeks, I would say, but sometimes quite a bit longer than that. So this is the classic appearance, caseo-necrotic bronchopneumonia. This is just another example. Again, it's this front and bottom part of the lung, the part of the lung that's toward the head and towards the belly of the calf, whereas the back upper part of the lung is typically not affected. And again, nodular lesions here, and when we slice into it, this is not liquid pus. This is this kind of feta cheese type consistency material. I actually like feta cheese, and I like Mycoplasma bovis as well in its own way. These were, we did some experimental studies in calves, so these were experimentally infected calves. Many of them had this lesion of just little angular red areas within the lung. This would represent one lobule or one little room within the lung tissue. This is a very non-specific lesion. If I saw that in just a natural case of BRD, I wouldn't really know what the cause was. But quite a few of these calves also had that same caseo-necrotic lesion, these little nodules present within the lung tissue. So we're pretty confident that when we see that, that's pretty specific for Mycoplasma bovis. Just a closer view of these little nodules within the lung tissue. Sometimes these nodules can join together and make very, very large lesions. It's a bit hard to get oriented here, but this is the right lung of a calf, and you can see half of that lung is entirely taken up by these abnormalities. And I guess I would like you to look at that and think, if you give an injectable antibiotic, it's plausible to me that you're not going to eradicate the bacterium from a lesion like that. You just can't get the antibiotics into that dead lung tissue. So it's kind of hard to prove this, but I think it's generally accepted that in addition to the antimicrobial resistance because of what's encoded in the genome of the bacteria, the other reason that calves may not respond well to antimicrobial therapy is they develop these dead areas of lung tissue either huge ones like this or smaller ones like that, and you can't get antibiotics into the center of those, the animal may appear to respond to therapy, but then once you discontinue the antibiotics, it may relapse. So then this would be what I call a non-specific bronchopneumonia. I think we see lesions like this very, very commonly in calves. It's just purple discoloration, again, of the front and bottom part of the lung, the trachea or the airway, and head would be on this side. This is very non-specific, so I don't know. Without culturing it, I can't really tell what would be causing lesions. And I've asked the question here, does Mycoplasma bovis contribute to that disease? And I think it's really hard to establish that. Often in calves that have had pneumonia for a period of time, we can grow Mycoplasma bovis, but knowing in those cases whether it's really playing a role in causing the disease, I think is difficult to figure out. So sometimes there's quite a mix of bacteria present within these, and knowing exactly which bacterium it is that's causing it can be difficult to determine. In the same way, we see, again, pneumonia with abscesses. So again, it's the front and bottom part of the lung. It's purple, it's firmer than normal. But in this case, we've got liquid pus in the center. I can squeeze that and kind of toothpaste or watery toothpaste comes out from that cut surface. Usually we could isolate Mycoplasma bovis from this, but there's other bacteria present within those lungs as well. And really being sure what role Mycoplasma bovis is playing in that, I think, is quite difficult. So that's pneumonia. Again, casio-necrotic bronchopneumonia, those little nodular lesions in the front and bottom part of the lung are the really classic appearance. Probably it plays a role in those other types of pneumonia as well, but it's a little bit difficult to be certain, especially if we have multiple bacteria that can be grown from that. We do have other disease manifestations from Mycoplasma bovis. One of those would be ear infections, middle ear infections, and the usual clinical appearance would either be calves with droopy ears like this or a head tilt like this, because the infection gets into the middle ear, interferes with the sense of balance from these calves. This is not because that calf has been chewing on his ears and that the infection has gone down the ear canal into the ear, but instead within the nasal cavity, there's a little tube that goes up to the middle ear, the eustachian tube or the auditory tube. So this would be an intranasal infection in this calf. That bacterium in the nasal cavity can either go down the trachea into the lung, or it can go up the eustachian tube into the middle ear and cause clinical signs like that. And that would be relatively common in young calves. The third major manifestation then, slide. This is just, it's hard to orient on this, but this is the skull of one of these calves turned upside down, and we're looking at the back part of the skull, and it's relatively easy to chip off the little bit of bone over that middle ear. And when we do that, we can see all of the pus filling up that what we call the tympanic bulla, a little ear-filled space usually within the middle ear. And it's usually a very traumatic lesion. I've never seen an example of a mild version of that. It's either normal and air-filled or it's completely filled with pus. And I presume that causes a fair bit of pain or discomfort in those calves. It certainly does in young children that have middle ear infections. The third manifestation then would be joint infections and lameness. It typically affects the joint itself, but it can affect the tendon sheath, this little sheath around the tendons here. Here the route of spread is a little bit different, that this would typically start in the lung, spread through the blood, and then settle in the joints because of that. Often multiple joints affected, but it can be a single joint. And when we see that in experimentally infected calves, that usually the joint infection or the joint disease usually happens about 9 days after the experimental infection. And this is just an example of that. If you pull on that yellow material, it's kind of elastic material that stretches, pulls away. So it's fibrin, basically what makes our blood clots, but because of the inflammation, it's entered into the joint cavity. This is a more severe example. Again, this fibrin, this yellow stretchy material filling up the joint cavity. Again, this is typically multiple joints. In beef calves, at least, sometimes, well, we certainly see that in joints that are detected to be lame, but we also see that relatively commonly in limbs that, or animals in which there's no detectable lameness. And then the final point is with Mycoplasma bovis pneumonia, with Mycoplasma bovis arthritis, typically the response to treatment of those animals is much more poor than it is for pneumonia. And again, to me, one of the reasons is you've got all of this material within the joint cavity that contains the bacteria, but being able to get your antibiotics into that joint cavity, I think is a difficult thing. So it's difficult to eradicate the bacteria. This is just a more extreme example where it's more of a pus, more liquid pus within the joint cavity. And then the last major manifestation would be mastitis, which is really not relevant to, well, it's not something that veal calves get, but it's relevant to veal calves because they may become infected from milk if they're milk fed. This can cause clinically apparent mastitis, abnormal milk, but it also may have cows that are infected with Mycoplasma bovis that don't show any clinical signs at all. So just because the milk looks normal doesn't mean that it may not contain Mycoplasma bovis in it, and it may transmit it to calves as well. Oh, and I promised that was the last one. Rarely we would see brain disease. Sometimes those middle ear infections can spread through the nerve that goes to the brain. This would be that nerve here in the open skull, and you can see this kind of proliferative tissue on the other side where the ear infection would be down in here somewhere, and the infection is spread up into the brain tissue as well. Again, this is not nearly as common as the pneumonia, the middle ear, and the joint infections. There are other various manifestations. We really don't see these very often, but if there's uterine infection with Mycoplasma bovis, it can cause abortion and neonatal deaths. We can get infections on the heart valves, skin lesions, and conjunctival lesions as well, but those would be less common. How do we diagnose Mycoplasma bovis? It's pretty easy, I would say, these days. In the past, it was much more difficult. Clinically, I think if you just have a case of pneumonia, it's very, very hard to determine. If it's only lung signs, it's hard to determine if it's Mycoplasma bovis or something else. I think most people or most vets would agree if you have chronic pneumonia, pneumonia that's been going on for a long period of time and perhaps doesn't respond well to therapy, then the likelihood of Mycoplasma bovis increases. If you have chronic pneumonia and you have arthritis or middle ear disease in the same calf or the same group of calves, then I think a lot of people would start to suspect Mycoplasma bovis in that situation. If we have animals that die and we do a postmortem examination, I think if we see those nodular lesions, those casonecrotic foci, that's, I think, really specific for Mycoplasma bovis. I think other BRD pathogens really don't result in that appearance. Or, again, at postmortem, if we see both bronchopneumonia and either arthritis or middle ear disease, I think our suspicion would increase. We can test, for example, lung tissue or joint fluid, either by molecular testing, by PCR, or by culture, and both of those are quite effective at identifying the bacterium. But an important point is, in a group of animals, most of the animals that are infected will appear healthy. And I'll come back to this later. For me, that's really the focus of my research, is how to explain that in a group of animals in which there is Mycoplasma bovis present, by far the majority of those infected calves will appear clinically healthy. So So the implication of that is just because you grow Mycoplasma bovis from a tissue does not mean that's responsible for the disease. You really need to see a characteristic appearance of the disease as well. We need to see, for example, these lung nodules in order to confirm that the disease is caused by Mycoplasma bovis. I put this in, and I'm not sure how useful this will be for you. You can certainly take blood samples and detect antibodies to Mycoplasma bovis. That is not useful to diagnose an individual animal with Mycoplasma bovis disease, and it's mainly used to identify whether the bacterium is present in a group of animals. So as an example, again, in New Zealand, their method to detect if a herd was infected or not and needed to be depopulated was based on one of these two tests, either molecular testing or detecting antibody in blood. So I think the only way that this would be relevant to you is if you want to source calves from Mycoplasma bovis-free dairy herds, that would be a way to certify those dairy herds. But to my knowledge, that's not being done. But it is certainly, there certainly are tests available to do that. Okay, how the disease develops. Again, this is kind of the point of my research, and I'll give you just a couple of examples of the stuff that we're doing. Sequence of events, again, I've covered this already. So sources of infection typically would be direct contact with infected animals or ingestion of contaminated milk or colostrum. Bacterium is going to come into the body, typically through the respiratory tract or the oral cavity. The tonsil is susceptible to infection, and the bacterium can hide out there for a period of time. And then these other methods are important in other contexts. After we have established infection in the respiratory tract, then this bacterium can survive for a long, long period of time within the body. So even though there's an immune response to the bacterium, that bacterium can stay alive in the body for months and months in feedlot cattle, and I presume it stays for a similar length of time in veal cattle too. So persistent infection of respiratory surfaces, that bacterium can go up the auditory tube into the middle ear and cause middle ear infections and head tilt or drooping ears. It can go from the nasal cavity down into the lung and cause pneumonia, or it can travel through the blood to the joints and cause arthritis. For me then, these caseo-necrotic lesions, these nodular lesions, again, they're unique. They really don't happen with other causes of BRD. I think they're important because they shelter the bacterium. So antibiotics seem not to be able to get in there very effectively, and that presumably is one of the reasons that the infection persists, but we don't know why they occur, and that's something I'm, at the moment, trying to figure out. This is just a microscopic view of the lung, and we can see all of these. We get cells from the blood that come into the lung, trying to kill off that bacterium. But there's a battleground going on there, and the bacterium, which is represented by this brown staining here, seems to be able to kill those blood cells that are coming into the lung tissue. A little bit of data kind of on how Mycoplasma operates at a herd level. In beef calves, again, this is work that we did quite a few years ago. When this was a group of, I think, 60 calves that came into a feedlot west of Waterloo. On arrival, I think only one calf was infected based on lung wash. By day 15 after arrival, 72% of the calves in that group were infected, and by 2 months after arrival, 86% of the calves were infected. And similarly, high numbers, but quite variable. Again, another study. Some of those calves, again, were persistently infected for months and months. So although there's an immune response, it seems not to be necessarily protective against disease. veal and dairy calves, again, high numbers of animals within the group. If they're being commingled from different sources, I think you can anticipate that over time, quite a few of those animals probably will be infected with Mycoplasma bovis, but it's quite variable. This was another study in dairy heifers, and even though there was commingling of animals from different sources, only 4% of the animals in this study were infected. And we don't know the reason for that difference, why in some groups of animals it seems to spread throughout the whole group, and in other animals that it's maintained as relatively few animals that are infected. Same thing with dairy cows. Again, 0.2% infected after an outbreak of disease. In this study, this one had 33% infected. Same sort of story. So there's a lot of variability in how the pathogen transmits within a group of animals, and I don't think we have a good handle on why that occurs. This is my speculation, so this is based on data, but I would say it's not hard fact. I think animals have this is probably hard fact, animals have an increased risk of infection if there is introduction of new animals, or if there's commingling of animals from different sources, which would be probably common to your situation. If there's a large herd size, this would be most relevant to dairy herds, and if there's crowding of animals. And this makes intrinsic sense, I think, if it's an environment where there's a lot of animals coming together and they have nose-to-nose contact and very intimate contact, then it's more likely that the bacterium will spread a lot within that group. Things that increase shedding of the bacterium from one animal to another. In dairy cows, we think calving is one such trigger, and maybe the stresses of calving, transportation of beef calves seem to increase the shedding of Mycoplasma bovis, and again, perhaps of young dairy cow or young Holstein calves as well, but I'm not sure that that's been studied. And perhaps inflammation that I'll talk about in a moment. And then things that actually increase the development of disease that leads to an infected calf to progressing to disease. I think probably the presence of infection with other bacteria in addition to Mycoplasma bovis, stresses perhaps, and then milk aspiration, especially, of course, if that milk is infected with Mycoplasma. This was a beef study we did quite a few years ago. These were auction calves. They were high-risk calves, so low body weight, multi-sourced. They did not receive antibiotics on arrival, and they came into the Ontario Beef Research Centre. I'll tell that in the next slide. I'll tell that here. We were trying to give an inflammatory stimulus. So we killed bacteria and we aerosolized it to the calves, trying to mount an inflammatory response that we thought would protect these calves against development of BRD. And we sampled those calves repeatedly after they arrived to the research center. Sometimes life doesn't turn out at all like you thought it would, and sometimes that's bad, and sometimes that kind of opens up a new way of thinking about things. These differences between the groups were not statistically significant, but there was a trend there. So the pink bars then are the control calves that received just saline after arrival. These are the calves that were aerosolized with they inhaled the killed bacteria that induced some inflammation in the lung, but there's no infectious agent in that situation. We thought these guys would be protected against disease, but you can see that they had a higher treatment rate than the other calves. 72% of those calves needed treatment compared to 53% of the other. And the quite surprising finding was that the mortality rate in this group that received the inflammatory stimulus was disturbing, I would say, as the researcher doing this work. And again, that was the opposite of what we anticipated, and the mortality of these calves was the result of Mycoplasma bovis pneumonia. So that kind of changed our way of thinking about how BRD developed, and a couple of collaborators had very similar findings that seemed that inflammation soon after those calves arrived to feedlots seems to result in a worse BRD outcome than calves that don't have inflammation in their respiratory tract. I think I'll skip this slide again. To follow up on that, we did an experimental study. So we got newborn Holstein calves from the Dairy Research Center. They were obtained before they had any contact with the dam, so they've got no colostrum, and they're also not infected with Mycoplasma bovis. We brought them into the isolation unit, raised them as follows, and then they got challenged into the lung with one of three different challenges, either Mycoplasma bovis alone, Mycoplasma bovis plus our inflammatory stimulus, the same one that I mentioned before, or Mycoplasma bovis plus Mannheimia hemolytica, which is the classic cause of shipping fever pneumonia in cattle. We wanted that just as a transient inflammatory stimulus, sort of like this one here. So we gave them an antibiotic 24 hours after being infected with Mannheimia. That antibiotic is effective against Mannheimia, but again, because Mycoplasma doesn't have a cell wall, this antibiotic has no effect on the Mycoplasma. So basically, these two groups are getting an inflammatory stimulus. This group is not. A weakness with the outcome of this was none of those calves got really severe disease. They did develop these nodular caseonecrotic lung diseases, but they didn't get, half the lung affected with pneumonia, and that was a bit of a flaw, I would say, in this study. The outcome of this was, of the animals that were infected only with Mycoplasma bovis, we ended up quantifying the number of these caseonecrotic foci within the lung, and only 2 out of the 8 calves that received only Mycoplasma bovis had any caseonecrotic lesions at all, and the other 2 that did have caseonecrotic lesions had low numbers of those, whereas all of the animals that had both transient Mannheimia infection plus the Mycoplasma infection, all of those that were infected with both bacterium had caseonecrotic lesions, and typically quite a bit higher number of those lesions than the control animals. And then the ones that received the killed bacterial lysate were intermediate. So our interpretation of that is that it supports the finding of the other study, that it seems that one of the reasons that animals that are infected with Mycoplasma bovis progress to clinical disease may be that they have some other inflammatory stimulus, such as some other bacterial infection at the time that they're infected with Mycoplasma bovis. And that could be another bacterium, or it could be viral infections that they have at that time, but probably that combined infection plays a role in forcing that disease to progress. We're following that up now, so we take blood cells and we culture them in vitro. It's hard to work with calves because they're so variable, and using large numbers of calves for experimental studies is really difficult. For now, the follow-up for this is taking blood cells, culturing them in the dish. We infect them with Mycoplasma bovis, and you can see that the bacterium seems to be able to kill those cells. Not many of them left out here, where they get lots of Mycoplasma compared to these ones that get none. And when we do that in vitro, this is really preliminary data, but we seem to find the same thing, that just the inflammatory stimulus alone doesn't kill those cells. Just the presence of Mycoplasma bovis alone, when we compare those two, doesn't seem to kill the cells. But when we give those cells an inflammatory stimulus, like we did with the little baby calves, and then infect them with Mycoplasma bovis, it seems to be able to kill those cells. So it gives us a platform in which to study that response in vitro. So I'm going to finish up then by saying these are ways. So again, my business is not really controlling or managing disease on farms, but based on what we know about the disease, then I think these are strategies that people take. First of all, eradicating Mycoplasma bovis is difficult or probably impossible. The New Zealand government spent, I think, $1 billion New Zealand dollars eradicating Mycoplasma bovis from the country. And I think doing that in Canada would be a much greater task because it's already well established. So I think we can probably cross that one off the list, at least at a country level. You might avoid bringing Mycoplasma bovis into a herd. Again, this is, I would say, impractical probably on veal operations, but on the dairy operation, quarantining new animals or maintaining a closed herd would be one approach. There is evidence that pasteurizing or acidifying milk kills Mycoplasma bovis. So if milk is being used, that would be one approach to preventing infection from it. This is just general stuff that you hear all the time, but I think it's true. Promoting health and resilience of the herd, minimizing co-infections, which again our work I think really supports co-infections and inflammation. So maintaining calf health and nutrition. We know that animals that are sick because of Mycoplasma bovis shed a lot of the bacterium. And the slide that I skipped shows that the animals that have a really high load of bacterium are much more likely to have clinical disease and not respond well to therapy. So it makes sense that if we can reduce the infectious disease challenge, if we can prevent those clinical cases from transmitting to other calves, then that may be effective in preventing it from spread. So early identification, treatment of clinical cases, targeted antibiotic administration, again, metaphylaxis on arrival in beef feedlots would partially aim to do that. There's not great evidence that it certainly doesn't eradicate Mycoplasma bovis, but it perhaps reduces the disease occurrence. Separation of younger and older calves, managing stocking density, and then these things relevant to dairy herds. Vaccination at the bottom has a question mark. I don't have data on this, but there is a vaccine that's been out for, I guess, probably 2 or 3 years. I have not seen data on how well that is performing in the field, and some of you probably have more experience with it than I do, but that would be another approach to limit disease. That's all I have to say. Funding sponsors, thank you, and graduate students who, of course, do most of the work. Happy to answer.